Back into News Channel 11 at 5:30. I'm Josh Smith. Sarah will rejoin us in just a moment. COVID-19's effects have waxed and waned over the past several months as cases have risen and dropped during the pandemic. But nursing homes and long-term care facilities have felt the impact in a sustained way, really an unrelenting way for months. Here's Sullivan County Medical Director Dr. Stephen May.
They've been through a pretty major challenging 4 weeks. Many facilities have had major outbreaks, and they've been dealing with those challenges both in their staff and the residents.
Digital reporter Jeff Keeling's been following nursing home numbers very closely. And Jeff, you've been waiting for some sign, some indication there would be a relief for these facilities, for the residents, for the administrators, for the caregivers, and for their families. What are you finding at this point?
Well, Josh, it's been a grim week-by-week look at those numbers. You know, a few times things flattened for a few weeks, but that never really would stick. You can see in graphic 1 the number of long-term care residents who've tested positive for COVID by week since late August. That line just shows a steady, almost unbroken rise from a little over 300 back in late August to 1,776 reported last Friday.
Steady for sure, but right at the very end there, it kind of looked like maybe a little bit of at least a smaller increase, if not a decrease. What are we seeing in that latest part of that graph, Jeff?
Right, you're right, and those are cumulative numbers, so it's always going to be an increase or flat. But only 11 new cases were reported in the last week, and you know, that's among residents. And Dr. May mentioned there's potentially some light at the end of the tunnel. You know, we can only hope that is indeed going to be the case.
Absolutely, absolutely. And you mentioned the residents' population in that data set, but what about staff? Obviously, that is a major way that the virus gets into the facilities. Many of them are locked down. You've talked about workers, some of them being asymptomatic and just not realizing that they may have been bringing that virus into the facilities. What kind of numbers are we seeing specifically among staff?
Yeah, and I mean, you can imagine how that feels for the staff when they realize that happened. You know, it's just totally, they don't mean it to happen, but it's been a similar trajectory with staff. If you pull up graphic 2, you see it's pretty remarkable. The number of staff who have now been positive isn't far below the resident total, and it's also been a similar kind of increase. We had 3 or 4 weeks in late September to mid-October when it looked like things were maybe going to flatten out for the long haul. You can see it near the middle of that chart, but then cases resumed a steeper increase with both staff and residents.
That's a lot of people, almost 3,000, a decent percentage when you factor it in of the entire total of cases for the whole region.
Yeah, that's right. I mean, more than 5% of the cases in the region have been in long-term care.
Wow. Okay, you've talked about how the trends, or how that tends rather to be sort of the worst impacted population with their age, with their underlying conditions, making them the most vulnerable, and that has had an impact in terms of the overall death numbers as well.
Yeah, you know, the first time we talked about long-term care outbreaks, there were fewer than 50 deaths at that point. Chart 3, it shows that, unfortunately, that's been tracking right along with the resident case numbers. Just a really steady march upward. Now, you might be able to see a flattened line at the right end there, where there were only 2 deaths last week reported, and that's actually the lowest number since I started charting this. That's encouraging, and like Dr. May said, we can hope that that line graph flattens out like it teased us with back in the early fall, but that this time it stays on a flatter trajectory forward. That would certainly be a big relief to the many families and workers in our area.
Several weeks ago, I think you were saying that the number was like 40% of all the deaths in the region happened in long-term care facilities. Are we still at that 40% range? How's that looking now?
Well, if you pull up graphic number 4, you can see it has abated some. The long-term care deaths are on the left there, and on the right you see deaths from all other sources at 509. That now represents about 37% of the total deaths, the long-term cares, and that's obviously still very high. It's kind of to be expected with the age and comorbidities, but people in those facilities often have, so it's still a very significant chunk of the fatalities.
All right, and you were saying, Jeff, that you know, the impacts are there. Is there anything that's giving you some hope at this point?
Oh, sure. Dr. May said the vaccinations taking place are a great cause for hope. You know, both pharmacy chains that are in the National Long-Term Care Vaccination Program have said that they've now offered it to 100%, the first dose, that is, of the people in our region. And, you know, so we're still probably several weeks away, though, from that second dose taking effect. And Dr. May had some positive things to say about that.
But the good news is we're getting people vaccinated in that critical industry to keep them, one, from carrying it in with their employees, and then number two, to protect the patients from potential disease.
Jeff, lots of information, and thank you for what you're doing to keep us up to date. This is digital reporter Jeff Keeling. His work right now posted on WJHL.com. Sarah?